Now, if you're currently dealing with lower back pain, or maybe you've been told that you have sacroiliac joint pain, then stay tuned because in this video, I wanted to show you the top 5 exercises that you need to be working on to help eliminate this pain for good. Let's get started. Welcome back, guys. It's Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, today we're going to be talking about SI joint dysfunction. This is commonly pain that's referred to the lower back, near the pelvis, and in between the sacrum. We call this sacroiliac joint dysfunction. Now, in the physical therapy world, typically we're providing exercises that are going to help stretch as well as stabilize this specific area. And many people that are dealing with this specific pain could be a variety of different factors. It could be maybe they fell down or they stepped into a hole and really jolted their pelvis, or maybe specifically for women that are pregnant, they're holding a lot of weight in this area, especially from the baby in the front, but as well as any type of traumatic event, maybe a car accident, or simply just staying in a static position for a long period of time. If you're someone who maybe sits at a desk for a long period, these joints get very stiff and it can cause these conditions like sacroiliac dysfunction. Now, the nice thing about this can be prevented and as well can be treated if you're someone that is dealing with this right now. The important factor that you have to consider is that you take these exercises slowly and you work on them one at a time. So today we're going to give you 5 exercises that you can easily implement at home to help get rid of this pain for good. So the first exercise that we're going to get it started is going to be extremely helpful, especially if you're someone that is dealing with a lot of pain. This is a muscle energy technique that can get rid of this pain instantly, so that then we can start focusing on a lot of the strengthening muscles that will help you get rid of this pain for good. So I'm going to use a half Rome roll just like so, or you can use a pillow at home, and I'll explain in a bit why we're going to need that. But essentially we're going to bring our knees up to the same level of our hip, and then with this left hand here, I'm going to be trying to pull my knee up as I'm using my leg muscles to resist against me. Now with this opposite hand, I'm going to be pulling my knee upward as I'm trying to push my knee down with my hand. So they're resisting opposite motions there. I'm going to hold for 5 seconds there, and then I'm going to switch. So now I'm pushing this knee down as I pull this knee up, and notice I'm using my core muscles, my hip muscles, and my lower back muscles to resist that motion. And also notice you're seeing very little movement between your legs moving. You shouldn't see your whole legs swaying like so. You're going to be keeping them nice and static. And if you do this correctly, you're going to feel all the deep muscles of the core and the hips working hard. So after about 5 reps on each side, 5-second holds in each position, we're going to take this pillow or this foam roll, and now you're going to squeeze your knees and your hips together, feeling the inner thigh muscles activating, and you might feel an audible or a click, which is typically normal. We're getting a nice release of that gas in between that joint, and all we're going to do that is 2 times for at least 3 to 5 seconds there, and then we're going to relax and start to move forward with the rest of the exercises. The next exercise that I believe often gets overlooked is that many people are focused on giving exercises for the hips and the glutes. And although this is extremely important, and we are going to get to that, many people forget about what the core does for stability of the pelvis and the lower back. So we're going to start with, I personally believe, is a Pilates exercise, which is great for the abdominals and the hips. Okay, we call this the Pilates. You might have heard of it as the hundreds exercise. And simply, you're going to be in this static bridge position. So your feet are underneath your knees, just like so. And you're going to start the exercise by taking a deep breath in through your nose. And then you're going to exhale all of your air. And this is where it's key. This is the most important part, is when you exhale, you should feel your rib cage compressing. You're letting all of your air out, and you're imagining as if your belt line is coming closer to your sternum. So everything should be getting tight in your midline. and using my arms, keeping them straight, because this is going to make this exercise more challenging, you're gonna start to wave them up and down. Now this may feel a little bit funny when you're starting this exercise, but if you're incorporating your breathing with this, you're gonna feel this really start to work your abdominals. You can perform about 3 sets of 10 repetitions with each hold for 3 to 5 seconds at the end. So you're gonna take a deep breath in through your nose, exhale, let all the air out, feel all of the abdominal walls tighten up. And also notice with my head, I'm kind of keeping a slight chin tuck and my head is off the ground. I'm not doing a full crunch. So we do have our head elevated from the ground, but now you're gonna really start to feel those upper abdominal muscles kicking on with this exercise. Now we know that single leg stability, especially when we're talking about the posterior chain, the glutes and the hamstring, is going to be extremely important because it helps support a lot of the structures of the lower back and the pelvis. And this is why the single leg bridge is probably one of my favorite exercises to help identify imbalances between the lower body. So you can perform this by just starting off with a regular bridge. So you're reaching your hips up to the ceiling. I've demonstrated this exercise in the past, but in order to level up this exercise, you can shift your way to one leg and now start to bring one leg off the ground. Now, if you're weak on this right side, you're gonna feel your pelvis start to rotate or maybe even drop, and it's gonna feel difficult to really push through the heel that is on the ground. Then you're gonna return to that starting position and then once again alternate, really try to identify, do you feel a difference between both sides? And what you should feel when you're working here is all the muscles of the bottom and back half of the leg really working hard. That's the glutes, the hamstrings, we call that the posterior chain. And you can perform about 5 reps on each side for 5-second holds, which is going to light up your legs like crazy. All right, we're gonna continue on with hip strengthening exercises, which are gonna be great for stabilization of the pelvis and the hips. And here we're focusing on the hip abductor muscles. This is one of the glute muscles that's smaller than the typical glute max muscle that we're often used to training. But this muscle here is extremely important when it comes to stabilization and symmetry in the pelvis here. Now, if you notice, I have a band that is wrapped around my knees because quite honestly, when I perform this without a band, I personally don't feel much resistance or I feel like it challenges me enough. But just know you can perform this exercise without the band, but I'm gonna demonstrate it with the band here. So what you're gonna do is you're gonna prop up on your elbow just like so, and I already feel my obliques and my abs working. Now I'm going to lift my hips up towards the ceiling and I'm using this leg to push away from the ground. So I'm using those hip muscles, and now with this top leg, I'm going against that resistance band and I'm gonna separate my knees. So notice also my feet are together and I'm gonna feel a lot of the hip muscles up here at the top really working. So I have both these at the bottom as well as at the top working extremely hard. And most importantly, I have my obliques and my abs tying into my trunk, working hard because I'm using my elbow pushing into the ground. I often see people do this incorrectly by just allowing their hips and their arms to kind of sag. Really, I want you to keep an active shoulder and really focus on keeping your body in a nice straight line and not letting your body turn or rotate just like so. You can perform those isometric holds where you're at the top, 3 sets, and ensure that you're doing both sides for 30 seconds at a time. Now, if you watched my channel in the past, you know that I am a firm believer of progressive overload. And I would be doing you a disservice if I just gave you exercises that were on your back and that were not functional. And that's why my last exercise that we're gonna go over here is probably the most functional exercise that you need to be incorporating to help ensure this pain does not come back. This is a great exercise, not only to stretch the glutes, but also strengthen the glutes. And this is called the kickstand Romanian deadlift. It's a kickstand RDL. So you're essentially gonna set up in this staggered stance, And the leg that I'm really working here is actually that front leg. Now I have a dumbbell here in front of me with about 22 pounds, but just know that when you're starting with this exercise, you don't need any weight to actually feel this in the glute area here. So essentially you're gonna be getting a nice little hip hinge. Notice I have a slight bend in the knee, and I have the weight primarily on my front leg, and this back leg, what we call kind of like a kickstand, I have slight pressure through the toes there, so it just keeps me balanced here. So essentially I'm gonna pick up the weight, okay? Nice tall chest here, and I'm taking the weight and I'm going straight down towards that front leg. I'm gonna almost feel this slight kind of rotational movement. This is where you're gonna feel a stretch through the back of the glute, and then you're gonna use those glute muscles to stand all the way at the top. Okay, notice you're gonna keep the weight nice and close to your body, feel a nice good stretch, and then you're gonna stand up at the top. Very similar to a traditional deadlift where you're standing up, but essentially now we're working one leg at a time. I wanna show you once again from the side view here so you can see what's going on back here. I'm in this staggered stance. Obviously you're gonna ensure that you are working both legs, but here we're gonna focus only on the right side. You're gonna pick up the weight just like so. We're gonna reach down towards that front leg, using that back leg to kind of keep us balanced. Once I go as far as I can by touching the dumbbell close to my foot, I'm gonna stand up to the top, okay? Once again, feel a stretch. You should feel these glute muscles stretching, and then you're gonna use that leg muscle to really stand up at the very top, okay? As you're performing this, you wanna work on about 3 sets of 10 repetitions at a time. And this is going to be a fundamental exercise that you need to be incorporating, especially if you're anyone dealing with this sort of condition. There you have it. If you're someone dealing with this nagging, achy lower back pain, give these 5 exercises a try and let me know in the comments below how this worked out for you. In the meantime, if you're looking for more ways on how to improve your back health, take a look at the other videos I've made on my channel here. I'll see you in the next one.